Now, once you are getting suspicious of the fact that the patient can be suffering from acromegaly, you are going to have a list of etiologies and pathological factors, and you want to have a definitive diagnosis in the patient. So how do you go about and make a definitive diagnosis? The lab investigations usually consists of a basal growth hormone and IGF-1 levels. The growth hormone levels should be less than 0.4 micrograms per liter, and normal IGF-1 levels should be maintained, and then only you can rule out the acromegaly in these patients. So these cutoff points should be kept in mind. Growth hormone levels more than 0.4 micrograms per liter or elevated IGF-1 levels, you're going to conduct a growth hormone test. Along with that, you're going to have an OGTT, that is an oral glucose tolerance test. So usually patients who have these tests deviated, the oral glucose tolerance test is also deviated for these patients as well. The growth hormone levels are almost less than 0.4 micrograms per liter. And usually we can have the test results that are pointing out towards a growth hormone levels more than 0.4 micrograms per liter. Then only you can make a diagnosis of acromegaly in these patients. Then obviously the clinical features of acromegaly would basically result from the measures of the IGF-1 levels that are very crucial at this point. Normal for that particular age group. So you're going to basically correlate the age group along with the levels of the growth hormone. Males and females have different cutoff points. We are going to basically keep that in mind as well. Active acromegaly has to be ruled out, and the elevated levels, if they are found while we are performing the OGTT and measure the GH levels along with that. If there is an adequate growth hormone suppression, and we can have two outcomes basically, an inadequate growth hormone suppression. In case of an inadequate growth hormone suppression, we are going to move on with the pituitary MRI, because that is going to reveal whether the patient is suffering from any kind of an adenomatous condition or not. Pituitary masses are looked for, and you also look for the growth hormone secreting pituitary adenomas as well. Then we have a normal or small pituitary gland. We are going to look for the chest and the abdominal CT and measure the growth hormone releasing hormones. In patients where we have normal chest x-rays and abdominal CTs and chest CTs are ruled out at this level, we have to consider the extrapituitary acromegaly for these patients. So this is basically a step-by-step manner in which we move about. First of all, we are basically going to rule out the pituitary causes and then move on to the extrapituitary diagnostic factors. You are going to first of all order for the blood levels, measure the hormonal levels, and the key points that you have to keep in mind is that basically first of all the blood levels are noted down, and then you move on to the radio imaging techniques. For instance, the x-rays, MRIs, and the CT scans are called upon for.